the presentation of the Magnet Nurse of the Year Awards. While there are thousands of outstanding nurses, and they're all in this room, absolutely. Each Magnet organization may only nominate one of these outstanding clinical nurses for this prestigious award. Michael, I'm coming.
Before we announce the honorees, please join me in thanking our silver sponsors once again for supporting the National Magnet Nurse of the Year Awards: API Healthcare, Kindred Healthcare, Mölnlycke Healthcare. The coveted awards will be presented by our 5 esteemed members of our Commission on Magnet Recognition. To start us off, please welcome back the chair of the Magnet Commission, Dr. Donna Havens.
Our first Magnet Nurse of the Year Award is for transformational leadership. The transformational leaders identify a needed change, create a vision, and execute the change in partnership with a committed team. They inspire followers to achieve extraordinary outcomes and in the process develop their own leadership capacity. Described as a pioneer and a tireless advocate, our award winner transformed the way care is provided to patients with bleeding disorders by conducting groundbreaking research for better pain management in hemophilia patients. She conducted research with adult hemophilia patients in a tri-state regional study and then progressed to several national studies. The results were published in the highly acclaimed World Journal of Hemophilia. They were presented nationally and internationally and have been cited around the world by authors and presenters. As the principal investigator of a research project funded by the Health Resources and Services Administration, she conducted a comparison study evaluating patient outcomes in a nurse practitioner-managed hemophilia treatment center versus those achieved in a physician-managed treatment center. The outcomes in these 2 centers were similar, demonstrating that advanced practice nurses can achieve excellent results in their medically managed treatment centers. As the leading clinician in the only bleeding disorders center in the United States medically managed by nurse practitioners, she provides primary care and education to patients and their families on how to best live with hemophilia. Through these efforts, patients are kept out of the hospital and enjoy a higher quality of life. Please join me in congratulating our 2015 Transformational Leadership Award winner from Munson Medical Center in Traverse City, Michigan, Dr. Michelle Whitcup.
Thank you, Commissioner Havens. In 2004, at a dinner with colleagues, I discussed seeing patients use hemophilia clotting factor to treat their associated pain. This discussion identified a great research question, which in turn led to development of our innovative research team. Our research revealed that the majority of patients receive pain management from their hemophilia treatment center providers. And unfortunately, many patients feel that their pain was not well managed. Why? We discovered that patients with hemophilia use similar words to describe both acute and chronic pain. Furthermore, many patients use factor replacement therapy inappropriately as chronic pain management strategy. Based on this research, extensive patient and provider educational programs were developed across the nation. Scrutiny and interest followed. Our nurse practitioner medically managed treatment center was awarded a HRSA demonstration project of national significance. We hope the evidence from this project demonstrates the value of nurse practitioner models so it can be replicated in hemophilia treatment centers across the United States. Goal setting and tenacity are learned traits of transformational leaders. My strongest advocates have been my colleagues, nurses, physicians, and social workers. They help me to set strong goals and vocalize needs and act upon my visions. With them in mind, I humbly accept this award on behalf of my colleagues and our research team at Munson Medical Center. Thank you.
Congratulations, Michelle. I am Magnet Commissioner Veronica Casey. Our next award is for structural empowerment. Magnet recognised organisations build structural environments that promote and develop strong partnerships with community organisations to improve patient outcomes and the general health of the communities they serve. This award winner is a champion for adult cardiology services. She brought forward evidence identifying at-risk populations and then added onto her vision by developing Colorado's first cardiac early detection program. Her ideas for unique cardiology interventions resulted in implementation of Colorado's first outpatient TIA clinic and cardiac short-stay emergency department, where patient outcomes have outperformed national standards. She has advanced professional nursing practice through development of inpatient and outpatient evidence-based protocols and related competencies. Her work resulted in her organisation becoming the first Colorado hospital to achieve triple certification in heart failure, in atrial fibrillation, and as a chest pain centre. Her leadership extends across hospital interprofessional committees, community education and outreach groups, state advanced practice RN association and national professional groups. Her expertise in cardiology has been recognised by academic, business and advanced practice organisations that have sought her as an expert speaker and a research participant. The models of care she developed have become templates for service enhancement throughout Colorado, indeed the United States of America. Please join with me in congratulating our 2015 Structural Empowerment Award winner from Porter Adventist Hospital in Denver, Stoney Stanley.
Thank you, Commissioner Casey. In my first job as a telemetry nurse, I learned I had a passion for cardiac patients. I became a cardiac advanced practice nurse 4 years later. In 2005, I became involved in an outpatient cardiac primary prevention program for retired professional athletes, partnering with a local football team. Go Broncos! I recognized that the traditional risk assessments we had used for years fell short of treating and preventing sudden cardiac death and acute coronary syndromes. I proposed a new program of early detection at Porter Hospital, which would require a change of mindset. With extensive collaboration among nurses, cardiologists, radiologists, primary care, and the CT department, we developed protocols using the SHAPE guidelines. We implemented a new model to screen for asymptomatic atherosclerosis and to treat the individuals who bear the highest risk for a near future heart attack. As of today, we have evaluated and treated thousands in our community. The Broncos pilot program has evolved into a Healthy Heart Hero programs of the Denver and Glendale Police Departments, and this year's expansion to Arvada firefighters alone has already resulted in over 175 evaluations and multiple cardiac follow-up referrals. This award gives credibility to the value of the advanced practice nurse's role in a magnet organization and to those who have worked alongside me for years. Thank you very much.
Congratulations, Tony. I am Magnet Commissioner Angela Creda. I'm here to introduce our Magnet Nurse of the Year for exemplary professional practice. Exemplary practice in Magnet-recognized organizations is evidenced by nurses partnering with patients, families, and interprofessional teams to positively affect patient care and outcomes. This award winner has served as a clinical nurse specialist in neurosurgery for nearly 20 years. She is the co-editor of the internationally known textbook titled Nursing Care of the Pediatric Neurosurgery Patient. She has made significant contributions to clinical practice through her involvement in research. She served as the primary investigator for a study correlating lumbar puncture pressures to intracranial monitoring pressures, which indicated that lumbar puncture pressures are unreliable measurements in children. As a result, her organization now uses intracranial monitoring devices for surgical intervention decision-making, which has resulted in reduced invasive procedures. With a keen eye for identifying educational opportunities, she has created several novel teaching modalities. For example, she developed a mock herniation tool that is used to help healthcare providers learn to respond in emergency brain herniation events. The tool has since been published in the Journal of Neuroscience Nursing and was recognized by the American Association of Neuroscience Nurses with the Christina Stewart Amadei Writing Excellence Award. Her expertise, research, and innovative approaches to care have been published in numerous professional publications and presented at national and international conferences. Please join me in congratulating our 2015 Exemplary Professional Practice Award winner from Children's Mercy Hospitals and Clinics, Kathy Cartwright.
Thank you, Commissioner Creda. I've always wanted to be a nurse. Back in grade school, when someone was injured on the playground, I was always one of the first responders, always eager to help. When I first became a pediatric clinical nurse specialist in neurosurgery, I discovered there wasn't a reference book about the specialty. Over time, and after much discussion with my colleagues, we decided that we needed a reference book for nurses taking care of these patients. Specifically, a book that uses case studies, presenting symptoms, practice pearls, and patient and family education. This information helps nurses understand the care of the pediatric neurosurgery patient. Suddenly, it hit me. We needed to write the book. We didn't have any idea how to publish a book, so I started by sending an outline to several medical publishing companies. Sadly, the proposal was rejected many times. But with persistence over time, a publisher agreed to take a chance on us, and the book was born. Our efforts demonstrate that a passionate group of nurses can identify a need, take action, and influence the knowledge and practice of nurses to achieve better patient outcomes. I've been privileged to work with nurses who are dedicated to improving the health and well-being of children. I'm grateful for the opportunities I've had to make a difference in the lives of the children and their families, and I'm honored to receive this award. Thank you.
Congratulations, Kathy. I am Magnet Commissioner Yasmin Kazaz. Our next award is for new knowledge, innovations, and improvements, which are hallmarks of Magnet-recognized organizations. This award winner's new knowledge, contribution to new knowledge is exemplified by her nurse-led, randomized, controlled trial examining the use of a novel-shaped birthing ball to accelerate the labor process for women. The study findings demonstrated that labor is enhanced by optimally positioning the fetus to increase the pelvic diameter and allowing more room for fetal descent. Women using this ball had a shorter labor period during the first and second stages of labor. Her nursing research was published in the Journal of Perinatal Education, presented at conferences, and broadcast on national and international news networks. She also conducted an evidence-based project implementing pulse oximetry screening for congenital heart disease in all newborns greater than 34 weeks. Her team advocated for legislation to make this screening mandatory in all Arizona hospitals. As a result, Arizona House Bill 2491 was signed into law by Governor Jan Brewer in 2014. She is a key member of her organization's Placenta Accreta program, a first of its kind in Arizona, to address this potentially life-threatening condition of pregnancy. She uses her strong clinical knowledge to facilitate each nurse's ability to practice to their full potential and mentors nurses to become strong patient advocates. Please join me in congratulating our 2015 New Knowledge, Innovations, and Improvements Award winner from Banner University Medical Center in Phoenix, Arizona, Christina Tessie.
Thank you, Commissioner Kazaz. In year 2010, a nursing colleague proposed the idea of using a peanut-shaped exercise ball to decrease the length of labor and reduce the cesarean section rate. We conducted a research study using this new concept and realized great results. This new best practice was implemented across the Banner Health system. We published the study so that women across the world, including my own daughter-in-law, could benefit from this innovative practice. To further new knowledge and improvements in women and infant services, a multidisciplinary team focused on patients diagnosed with an abnormal placental implantation called ACRETA. We developed a standardized practice that resulted in decreased patient blood loss. Prior to this program, women with this condition lost an estimated 80% of their total blood volume. Today, blood loss has been decreased by 82%, which in turn means fewer days in the ICU and decreased length of stay. To enhance the birthing experience of all mothers, we implemented maternal and newborn skin-to-skin practice, not only for vaginal deliveries, but also for cesarean section births. Historically, after a C-section, we whisked that poor baby out of the OR, making the mother wait to be reunited with her infant. By providing skin-to-skin contact in the operating room during the cesarean section, we increased maternal satisfaction and breastfeeding rates, and decreased term infant NICU admissions by 84%. I am honored to be selected for this prestigious nursing award. Banner University Medical Center Phoenix nurses achieve the best patient outcomes because they are empowered to lead, establish new norms, and develop collaborative partnerships with physicians and healthcare providers. Thank you.
Congratulations, Christina. I'm Commissioner Brian Seelig, and our final award today is for empirical outcomes. This award winner transformed wound care delivery by establishing her organization's first multidisciplinary team aimed at pressure ulcer reduction. She led the team's participation in the Child Health Corporation of America's Pediatric Pressure Ulcer Collaborative, demonstrating outstanding, sustainable improvement. Today, with over 40 direct care nurses, she leads this group in monthly formal education, assessment training using inter-rater reliability, house-wide prevalence studies, and product evaluations. To meet the evolving wound care needs of patients across multiple services, she established a wound clinic, where advanced practice nurses provide continuity of care for hundreds of patients annually. As a nationally recognized pediatric wound care expert, she contributes to evidence-based practice guidelines through the National Pressure Ulcer Advisory Panel and the Society for Advanced Wound Care. Her ongoing collaborative translational research is developing a real-time 3D wound assessment tool. Her multiple publications are a testament to her impact on evidence-based wound care and the art and science of nursing. Please join me in congratulating our 2015 Empirical Outcomes Award winner from Children's National Health System in Washington, D.C., June Amling.
Thank you, Commissioner Seelig. The details of conducting research always intrigued me, but I didn't want to be a scientist working in a lab. I'm a clinical nurse, and I belong in a hospital with patients. As an advanced practice nurse for the wound team, I provide care for both inpatients and outpatients. In the advanced practice nurse-directed wound clinic, we assess, we treat, and we follow patients across the continuum. Dr. Gary Rogers, our clinical supervisor and chief of plastic surgery, empowers us as providers in our advanced practice roles. He advocates for us to perform independent wound care throughout the hospital, including the operating room and procedure rooms. With support from nursing administration, the unit-based pressure ulcer experts meet regularly for prevalence studies and data collection. We started with 3 ICUs. Pressure ulcer prevalence in the neonatal ICU declined dramatically from 17% to 2.5%. In the pediatric ICU, from 30% to 4%. And in the cardiac ICU, from 40% to 0%. We expanded these strategies to 13 units total and reduced pressure ulcers hospital-wide from 8% to less than 0.35%. In the eyes of children and their families, a pressure ulcer is a never event that can have devastating physical and psychological effects. Despite national efforts to reduce them, they remained an ongoing challenge for clinicians. Our team's commitment, steadfast efforts, and evidence-based practice move us all closer in the goal of eliminating pressure ulcers in this vulnerable population. Our motto at Children's National is, "Skin is in." We proudly displayed this slogan on t-shirts on prevalence study days, capturing the awareness and importance of wound care across the hospital. I am proud to be a leader and a clinician in wound and skin care. Thank you to my wonderful colleagues at Children's National as they make an amazing difference in our patients' lives every day. Skin is in. Thank you.
Fantastic, right? What can I tell you? All right, let's hear it one more time. A rousing time for the Magnet Nurses of the Year. I love it.